muscular system is the largest body system and forms nearly half of the body weight. The skeletal muscles of the body are organs because they are composed of several tissues in addition to skeletal muscle. There are approximately 230 different skeletal muscles in the body. Since most of them are paired and several have named subdivisions, the total number of muscles is about 600. A skeletal muscle contracts when it receives motor impulses that originate from the central nervous system. The potential motion that occurs during the contraction constitutes its action.
I'm Mike Shively, and this is Introduction to Anatomy and Physiology. Today we want to talk about the muscular system, basic concepts and functions regarding the muscular system. Now, this is one of 11 or 12, depending on how you count them, systems of the body. And when we say muscular system, what comes to mind? What do you think of? Adam?
Muscles.
Muscles. So a named skeletal muscle, like the biceps brachii, this muscle of intimidation of the 4th grade, is an organ, is it not?
Yes.
It's an organ. And it's an organ because it contains a lot of different kinds of tissue. If we take a look at the whole muscular system, there are about 600 total individual entities in the body that we call skeletal muscles. But many of those are paired, so there's left and right versions of the same ones. And then some of those individual muscles are actually parts of larger muscles, like the triceps brachii muscle that everybody is familiar with on the posterior aspect of a brachium here. That actually has 3 individually named parts. And you can count it as 3 separate, or you can count it as a single muscle. So a muscle, like a bone, is an organ because it contains many different kinds of tissues. Let's take a look at the first graphic here that summarizes what we just said in regard to the number. There's a total of about 230 individual skeletal muscles. Most of them are paired, 230 by name. Most of those are paired, so that makes 460 in most cases. And then many of those have named subdivisions. So when you consider all of those things put together, the total number of individual entities that make up the muscular system is about 600 total. The muscular system, in fact, makes up over half of the total body mass. So if you weigh 150 pounds, more than 75 pounds, actually it's close to 60% of your total body mass is made up by individual skeletal muscles. Let's make a list of the kinds of tissue that we find within a skeletal muscle. We said it's an organ, but what kinds of tissue would we find in it? What's the first one you ought to think of?
Skeletal muscle tissue.
Skeletal muscle tissue. So there ought to be some skeletal muscle tissue, and that is the functional tissue for contraction that actually allows this structure to get shorter. And when muscles contract, of course, they cause various things to happen in the body. But besides the skeletal muscle tissue, there's a lot of connective tissue proper that's present. As a matter of fact, those 2 tissues, skeletal muscle tissue and connective tissue proper, make up most of the mass of a skeletal muscle. But in addition to those, can anybody think of other kinds of tissue? Susan?
There'd be nervous tissue or nerves.
Nerve tissue. There's nervous tissue within skeletal muscles. They hurt when you bruise them, do they not? And we have to send impulses down to those organs to get them to contract. Skeletal muscles must have nervous impulses coming to them. And if we lose that innervation, those motor impulses that go to the skeletal muscle, it will no longer contract. And we call that condition paralysis of that particular muscle. All right, besides nervous tissue, Bryce?
Yeah, it also needs blood.
There's got to be some blood. And when we think of an organ that's going to have blood going to it, we have to think that blood gets there through structures that are called blood vessels, and they have what? Smooth muscle tissue in their walls. They have epithelium lining them, and they have some nervous tissue as well. So anytime we have a blood supply, we're automatically going to have those kinds of tissues. So there's several different tissues that are present. Let's look at a graphic that summarizes those. Let's see if we got them all. Skeletal muscle tissue is the contractile tissue that allows the muscle to get shorter when it receives nervous impulse. Connective tissue proper is an important physical component that holds everything together and allows that muscle to attach to other structures. Smooth muscle tissue is present in the walls of the blood vessels that supply that muscle. Simple squamous epithelium lines those blood vessels. Nervous tissue is present, and of course blood is present. So we have at least these 6 tissues that are present within a skeletal muscle. So this is the reason why skeletal muscle is an organ, because it's a structure, a body structure composed of 2 or more, in this case at least 6 different kinds of tissue. Any questions about that? Now, is the heart a muscle?
Yes.
Well,
It's an
yes, but
organ.
it's not. It's an organ, but it's not a skeletal muscle, is it?
No.
The heart has cardiac muscle tissue as well as some smooth muscle tissue within it. The heart does not belong to the muscular system. When we say muscular system, we're talking about all of the named skeletal muscles of the body. We're not going to count the heart because the heart belongs to the cardiovascular system, and it contains no skeletal muscle tissue anyway. Smooth muscle structures in and of themselves do not belong to the muscular system except as they may be part of, say, blood vessel walls and that sort of thing. So when we say muscular system, make sure that you conjure up in your mind just the named skeletal muscles of the body. Matter of fact, the only place that we find skeletal muscle tissue in our whole body is within the structure of skeletal muscles. And there's one other place. Can anybody think of a soft tissue organ that's part of the digestive system that has a little skeletal muscle tissue? Adam?
The esophagus?
The esophagus has a little bit of skeletal muscle tissue in it. Now, the esophagus belongs to the digestive system as far as the system that organ is part of. But during the initial part of the swallowing complex or the swallowing reflex, there's some skeletal muscle contraction in the upper part of the esophagus that helps start that bolus of food down. Have you ever been swallowing something and you realize that maybe you hadn't chewed it quite enough? You know, and you say, well, I'm going to bring that thing up and take a couple more whacks at it. And the reality is, there's a point of no return. Have you noticed that? To where when it gets so far down the esophagus, you may as well say, sayonara, it's gone, you know. Well, and potato chips are real bad about not being chewed enough, you know, particularly when you're sitting across from someone incredibly attractive. You just forget to chew that potato chip enough, and what's it feel like? It's slicing your esophagus open as it slides right on down there. Of course, you grab for whatever's liquid to try to soften those edges. But anyway, I've been there. Maybe you have too. All right. When we think of the parts of a skeletal muscle, they're very, very simple. Let's go to the overhead camera. Let's diagram a skeletal muscle. We'll just draw a fusiform structure, and we'll say that's the belly. That's the contractile portion. All the skeletal muscle tissue is found in that part. And then here at the ends, attaching that belly to some other structure, we have a tendon. Each end of the belly, we have a tendon. So we'll call that tendon. And we'll appreciate that a tendon can attach to different kinds of structures. Most of them attach to a bone. A few of them attach to cartilaginous structures. And in some cases, a tendon actually attaches to another muscle. By attaching to these other structures, when the belly contracts, those other structures are pulled on or moved. And then that constitutes what that particular action does from a functional standpoint. Let's see if we can make a list of the kinds of things that muscles do when they contract. In other words, when they pull on things, what is accomplished in the body? And can you think of anything, Adam?
They flex a joint or extend a joint?
Okay, flexing joints, extending joints, abducting limbs, adducting limbs, rotating body parts. We could put all of those kinds of body movements into one word. Does anybody remember a word we might have used in a previous session? Hazel?
Locomotion.
Locomotion. So when we talk about body movement, for the first thing we ought to think of when we think of muscle contraction probably is body movement. And the word that will encompass all aspects of body movement is locomotion. So that's one of several different functions that skeletal muscle performs. So when I'm walking around or moving my body in any manner, all of these kinds of movements, you know, flexion and extension, abduction and adduction, all that can be summarized under that heading. But right now, I'm not moving. What am I doing? I'm still having to contract some skeletal muscles to maintain this beautiful posture.
Posturing.
Posturing. We've developed a word, if we're not moving, but we still have to contract some skeletal muscles in order to maintain a certain body position, we can encompass that with the word posturing. So locomotion for body movement and posturing for just holding what you've got. You're sitting there in those chairs right now, and if it weren't for contraction of certain muscles, you'd dribble out onto the floor. Every once in a while, I have a student that'll go to sleep, you know, and fall over. The chair will roll one direction, the student will roll out on the other, you know. That does happen. Besides those two things, though, skeletal muscles do a lot of other things that we sometimes don't think about. What am I doing right now that you're not doing right now that requires skeletal muscle contraction? Eva?
Vocalization.
Talking. Just vocalization. There's certain skeletal muscles that have to be contracted in order to stretch the vocal folds a certain amount, to exhale air between those vocal folds so that they will vibrate and produce the voice, the sound of our voice. Vocalization is another thing. Now, what are we all doing right now?
Breathing.
Adam says we're breathing. And respiration requires contraction of certain skeletal muscles. The diaphragm in particular, but there's also intercostal muscles here between the ribs that are involved, especially when we're inspiring very deeply and taking a larger breath. We need to contract some of those muscles. So respiration is another one. Can you think of anything else, Bryce?
They can help keep us warm if we shiver.
Certainly, I don't believe God gave us all these skeletal muscles in order to keep us warm. There's other ways to do that, but there's no question that when we get cold, when you start to go hypothermic, you start shivering uncontrollably. And that is the body's attempt to reverse that process of hypothermia. Because when muscles contract, they do produce heat. There's no question there. And if you're physically working hard, you may overheat or you may feel much warmer than you'd like to be at that particular temperature. If you're splitting wood, for example, you can be outside on a pretty cold day in the wintertime if you're working very hard at that activity and have very little clothing on and still be quite comfortable. And everybody, I think, understands that. Everybody put your hand on your abdomen. Just put your hand right here on your abdomen. I want you to take in a big, deep breath. And then I want you to pretend like you're going to shout the word, hey, but... Oh, some of you turn blue. It's okay. Exhale. Okay. Exhale. I want you to shout the word hey, but I don't want you to let it out. Just start go, like that. Okay. Now, what we're doing is we are putting on what we call an abdominal press. Abdominal press. And that actually requires some interaction between the muscular system and the respiratory system. But that particular abdominal press has several uses in life. Can somebody think of one use in life? Anybody here play a brass instrument, a trumpet, a French horn? We have to forcefully exhale air in order to make those instruments make noise. Matter of fact, any wind instrument requires some of that, right? Stringed instruments, you pluck a string or make it vibrate with a bow or something like that, but the wind instruments require a little bit of an abdominal press. Anything else?
An emergency roadside pit stop?
Emergency roadside pit stop, I guess. Certainly, it's not required for the act of urination, but if you're in a hurry, you know, certainly it helps. Coughing, sneezing, childbirth, I'm told, requires abdominal press. So there's lots of uses of that abdominal press. Let me see if I can think. Can anybody think of any other functions of the muscular system? Adam?
Doesn't it have something to do with moving blood?
As a matter of fact, there are some roles of the skeletal muscles in venous return. Now, certainly the heart contracts, and that's the primary impetus force for moving blood through the arteries and venous channels. But venous return is assisted by contraction of skeletal muscles because the venous channels run in between muscle bellies. There are one-way check valves that allow blood to only move toward the heart and not back the other way within the lumina of those vessels. So the contraction of skeletal muscles does assist in venous return, certainly. Anybody think of anything else? Well, let's take a look at a master list. We'll look at a graphic here that summarizes the functions. I think we mentioned most of them. Certainly we mentioned locomotion and posturing, respiration, vocalization, abdominal press. We didn't mention specifically eye movements, but that's okay because eye movements could actually be included under the concept of locomotion. Usually we think of physically moving parts of the body outside, you know, the orbits or things like that, but certainly it's okay to list it separately. I put venous return and heat production here in parentheses because they are relatively minor functions. Certainly paralyzed individuals can still produce heat. I don't know if they produce as much heat as they would like to produce. And certainly their venous blood does return back to the heart without the skeletal muscle contraction that we talked about. But skeletal muscle contraction does play at least a minor role in these two things. Early digestion we didn't actually mention. The very early parts of the digestive process. Prehension is a word that just means getting food or drink into the oral cavity. Mastication is chewing it up if necessary. And then deglutition is swallowing it. So those are early digestive processes, and they require skeletal muscle activity or contraction. Actually, we could list even very late digestion if we wanted to, because the external anal sphincter at the other end of the alimentary canal is also skeletal muscle tissue within it, and it's voluntary muscle, as you know. So those are some of the kinds of things that muscles do. Now, let's go to the graphic that summarizes the structure we said for a skeletal muscle. Just want to make sure that we had that down. Only two major parts, a belly and then a tendon, typically at either end. Let me go to the overhead camera for just a minute because I want to expand this concept of tendon just a bit. When we usually think of tendon, the thing that comes to mind is a band or cord-like structure attached to a muscle belly, and most of them are in that form. So we'll put band or cord. And it's made of CT proper, connective tissue proper. There are, however, some tendons of a few muscles in the body where the tendon is not in a band or cord-like configuration. It's in a flat sheet. And again, it's formed of CT proper. When it occurs in this form, a flat sheet-like structure, the name given to it is aponeurosis. Kind of a funny word. But a flat sheet-like tendon is called an aponeurosis. Again, most tendons on most muscles are the cord or band configuration. But every once in a while, particularly in the muscles that form the abdominal wall, there's some very broad, flat, sheet-like tendons that their bellies attach into and then physically attach to other structures. All right. Any questions about those basic concepts? Bryce?
I read about a retinaculum that helps hold the muscles in place. Is that a tendon too?
You know what? There are several structures associated with skeletal muscles that are not actually parts of those muscles, but they are have a very close association with them. And let's see if we can talk about those just a little bit. The one that you bring up, let me put that word on the overhead camera for everybody to see, retinaculum. A retinaculum is a band of CT proper, connective tissue proper, that doesn't attach to the tendon physically, but it goes across the tendon and holds it in a certain location, kind of stabilizes it so that it doesn't move around. If you look underneath the hood of your car, for example, you'll notice there's a lot of nylon tie bands that hold the various wires and tubes in certain locations so that things stay more or less organized in that area. And a retinaculum does the same kind of thing by crossing over tendons of various muscles, or maybe in some cases groups of tendons. It will hold those tendons in a certain location. Let's pop back to that overhead camera for just a minute. Here you can perhaps see some of the tendons coming down on the anterior aspect of my wrist here, forming little swellings. There's an actual retinaculum that goes across these in much the same manner as my index finger is doing right now, that actually holds those tendons down against the carpal bones at the wrist. It's called a flexor retinaculum of the carpus, or carpal flexor retinaculum. There's actually one on the other side too that hold all of those tendons down against the wrist area. So that is a structure that, Bryce, it's not a tendon, but it does go across tendons and holds them in a certain location. Let me go back to the overhead camera because I want to make sure we clarify a couple other things now that you've brought it up. So a tendon is part of a muscle. Retinaculum is not, but closely associated. A ligament that we talked about in a previous session is a band of connective tissue that stabilizes skeletal structures at joints. What do all of these have in common? Well, they're all formed of CT proper. They're all made of connective tissue proper, and in most cases they're in a band or cord-like configuration. But this one here is part of a muscle. This is associated with a muscle, and this is a structure that's found as part of a joint complex. That help there, Bryce, clarifying that? Mm-hmm. While we're thinking about structures that are associated with skeletal muscles but are not actually parts of them, we've already mentioned in a previous session sesamoid bones. Let me put that on the overhead camera as well. These are teeny tiny seed-like bones that occur embedded within the tendons of certain muscles of the body. The biggest sesamoid bones, anybody remember what the biggest ones are, Susan?
Patella.
The kneecaps or patellae, those are the biggest ones. But the ones that are found in the tendons of the hands and feet are little teeny tiny nubbins of bone. The purpose of those sesamoid bones is to prevent frictional degradation of the tendons in which they occur. In other words, they form hard bearing surfaces where those tendons have to cross over rough bony prominences to prevent the tendon from fraying and breaking down over time. There are a couple of other structures that develop in association with skeletal muscles besides sesamoid bones. We go back to this overhead camera. We also have a bursa. And a bursa is a fluid-filled sac. Let's suppose this is a bony prominence right here that a tendon has to work back and forth. And here's the tendon itself. In order to prevent the tendon is, I've got a transverse section, so imagine it as the muscle contracts and relaxes, the tendon is going to work back and forth in and out of the plane of this drawing. I'll put some hatch marks on that kind of indicate we got a transverse section. To prevent the tendon from fraying as it works over this bony prominence, the body will actually insert a little fluid-filled sac in between the tendon and the bony prominence. Maybe if I make that a little bit larger, it'll be easier to see. Here's the tendon, here's the bony prominence, and here's the fluid-filled sac. And that fluid-filled sac is the bursa. What's the fluid in there? Synovial fluid, exactly the same kind of fluid that we find within a synovial joint. And so sometimes this is called a synovial bursa. So certain tendons in certain locations have a bursa associated with them. Again, the purpose of the bursa is to prevent frictional degradation as this tendon works back and forth over this bony prominence. Now, sometimes the bursa is so well developed that this part of it comes up this side of the tendon and this part of it comes up this side of the tendon, and they actually run into each other up there. So they basically, the bursa kind of completely surrounds the tendon, goes all the way around the tendon. And when we have that kind of a configuration, instead of a bursa, it's called a tendon sheath. And that's S-H-E-A-T-H. So a tendon sheath is just a very well-developed bursa that goes all the way around the tendon. What do all three of these structures have in common? Sesamoid bones, bursa, tendon sheath. They all help prevent tendons from frictional degradation. Just three different design plans to accomplish the same purpose. There's one other structure that I want to mention that's associated with muscles, but technically not part of the muscle itself, and that's fascia. Let me write that word on the overhead camera. Fascia is connective tissue proper, and it can be loose or dense connective tissue proper. The fascia that glues the skin to underlying structures in the body, we call that fascia superficial fascia. And superficial fascia actually is known by some other names. Can anybody think of another name that we might know superficial fascia as? Eva?
Hypodermis?
Hypodermis. Superficial fascia is also called hypodermis. And there's another name that also refers to this same substance. Susan?
Is it subcutaneous?
Subcutaneous tissue. And we could write it all the way out, or we could abbreviate it and cheat a little bit and say sub-Q tissue. Hypodermis is where the term hypodermic needle comes from. We're injecting something below the dermis of the skin, see? And subcutaneous tissue, superficial fascia, these all mean the same thing. The other category that fascia is put into is deep. And it's the deep fascia that has a close association with a lot of different skeletal muscles because it surrounds muscle bellies, it encases whole groups of muscles, and serves as an avenue of penetration within those muscles for nerves and blood vessels to actually go from point A to point B, to get from this part of the limb to that part of the limb. Those neurovascular structures will travel through deep fascia in order to move from one location to another. So those are just several kinds of structures then. Let's see, what all did we mention that are not parts of muscles but are closely associated. Let's take a look at a graphic that'll summarize those for us. We've got a bursa, we've got tendon sheath and retinaculum, fascia, sesamoid bone. Yes, we listed and talked about those, each one very briefly. Anyone have any question about those kinds of structures? All right, let's go to the overhead for just a second, and let's assume that we were going to study a muscle. What kinds of things is there to know about a muscle? Well,
What it does?
what it does, and anybody know the word that we use for the potential movement that's produced when a muscle contracts, Eva?
It's action.
It's action. So we're going to put the word action up here. That's the potential movement, the contraction of that muscle causes. Potential movement. Adam?
Would also want to know where it's connected.
Where it's connected. And there are words that are used for either end of a muscle, particularly in the limbs. We talk about the origin of a muscle. being its proximal attachment, or the end of that muscle that moves the least when contraction occurs, and the insertion of a muscle being the attachment at the distal end, within a limb at least, the end of that muscle that tends to move the most whenever contraction occurs. Something else, though, something I left a little room up here at the top, because probably the first thing we ought to list is what, Eva?
Its name.
Its name. All right, so it has a name. It has an action. It has an origin. It has an insertion. And we're not done, because it has a nerve supply. Innervation is the single word that means nerve supply. Innervation or nerve supply. It has a blood supply. It has shape. It has relationships with other body structures. There are a lot of individual things to know about a muscle. But we're certainly obviously not going to learn all these kinds of things about a lot of muscles. We might learn some of these kinds of things about a few individual muscles perhaps in the next session. But I just want you to appreciate that when we talk about a muscle, even though the parts are really simple, belly and tendons, we do have a lot of pieces of information that relate to that particular muscle. Let's take a look at the names of muscle. Well, I'll tell you what, before we do that, let's look at a graphic that summarizes what we mean by action. So let's look at this graphic. It says the action of a muscle is the potential movement that occurs when a muscle contracts. We said that a little bit ago, but I want to spend just a little bit of time clarifying that. The word potential is critical here. I'm going to contract my biceps brachii muscle. You see any flexion occurring at the elbow joint? Nope. Now I'm going to contract it. And what's happening at the elbow joint? I'm flexing my elbow joint, yes? Now I'm going to contract the same biceps brachii muscle, and what's happening at the elbow joint?
It's extending.
It's extending. Why? Well, because this particular limb is pushing down on it with a greater force than the contractile force over here. You see what I mean? So in the first case, I got no movement at all. In the second case, I got flexion of the elbow joint. In the third case, I got extension of the elbow joint. If the muscle that I'm talking about doing all this is the biceps brachii, its action is still flexion of the elbow joint. But you can get no movement, you can get the stated action, or you can even get a motion that's opposite to the stated action when a particular muscle contracts, depending on what the opposing forces and what other muscles may be contracting at the same time. So the point that I'm trying to make, and I'm sure this is not entirely clear yet, but maybe I can help it a bit, is the action of a muscle is not what happens when a muscle contracts, it's what the muscle tries to do. It's the potential motion. It's what the muscle's attempting to make happen. And then if the opposing forces are appropriate, maybe that movement will indeed occur. If the opposing forces are excessive, maybe the opposite motion will occur. If the opposing forces are exactly the same as the contractile force that the muscle is producing, maybe we'll get no movement whatsoever. So that's the point that I want to make there. Any questions about that? Now, a given motion of the body is rarely produced by the contraction of a single muscle. In most cases, there are multiple muscles contracting at the same time. And when muscles contract at the same time and several of those muscles are trying to do the same thing, and so they functionally accomplish this purpose, what do we call muscles doing the same thing at the same time? What's the word? Susan?
Synergistic.
Synergistic. Let's go to the overhead and take a look at this word. A muscle is a synergist if it has the same action, or we could say it is synergistic. If it has the same action. So when you see this word, think same action. Now, some muscles have actions that are antagonistic to each other. They have opposite actions. And so we use the word antagonistic to mean opposite action. The muscle is an antagonist or it has an antagonistic action. So this would be opposite action. Now what do we mean by opposite? Well, if the muscle we're talking about flexes the elbow joint, then the opposite action from that would be extension of the elbow joint. If the muscle that we're talking about supinates, then the opposite action would be pronation, and so forth and so on. So synergists have same action, antagonistic muscles have opposite action. Now some muscles, when they contract, only try to do one thing. And when we have a muscle that contracts and only tries to do a single kind of motion, like the brachialis muscle, it's a little muscle that sits behind the biceps brachii, right up against the humerus. And when it contracts, the only thing that it tries to do, if you will, is flex the elbow joint. It doesn't do anything to the shoulder joint, doesn't do anything down here to the carpal joint complex, simply tries to flex the elbow joint. That's it. That's called a single-actioned muscle. Only tries to do one thing, has only one stated action. And a lot of the muscles in the body are like that. They're single-actioned. There are, however, a lot of muscles that have 2, 3, or sometimes even 4 different things that they try to do. And those muscles are called, obviously, multi-actioned muscles. The biceps brachii, for example, when we start listing the actions of it, one of those actions is flex the elbow joint. One of the actions, because it attaches clear up at the scapula, is flex the shoulder joint. And because it hooks onto the radial tuberosity down here, which when it pulls on that radial tuberosity, it tends to rotate the antebrachium in this manner. It also supinates the antebrachium. Okay? So it has 3 different stated actions. Biceps brachii. It's considered to be a multi-action muscle. Eva?
So why is it that when I use that muscle, I don't always do all of those actions at once?
When we send motor impulses to the biceps brachii, it basically tries to pull its 2 ends toward each other, i.e. it contracts, it gets shorter, and as far as it's concerned, it's trying to do all of those things. Why don't we necessarily get all of those motions? How can I simply get pronation without any elbow joint flexion or without any shoulder joint flexion? Well, we can do what? Adam?
Send nerve impulses to different muscle fibers within the muscle.
In the case of the biceps brachii, we can't actually control its different actions by getting different parts of that same muscle to contract. That's a good thought, but that doesn't work here. Seth?
We could contract different antagonistic or synergistic muscles.
We could contract other muscles that would negate or counteract some of those stated actions, could we not? Let's go to the overhead and see if we can make this make sense, because this is a good point that Eva's asked about. We need to, let's just put biceps brachii, muscle, okay? And we'll say one of the things it tries to do is flex the elbow joint. And another thing it tries to do is flex the shoulder joint. And the third thing that we mentioned was supinate. I'm going to write A-N-T-E for antebrachium. Flex the elbow joint, flex the shoulder joint, supinate the antebrachium. Those are the 3 stated actions. Now, if we don't want this to happen, and we don't want this to happen, we could negate these 2 actions by actually contracting other muscles. In this case, we'd have to contract some muscles that did what? Extend the elbow joint. So we could contract some muscles that extend the elbow joint with sufficient force to simply negate the flexion that the biceps brachii muscle is trying to do at the elbow joint. And to negate this, to make sure we didn't get any flexion of the shoulder joint, we could contract some muscles that extend the shoulder joint, just with sufficient force to negate or exactly neutralize these particular actions. Does that make sense? If this is what we wanted to happen, we just want this, we can get it with this muscle as long as we negate this and negate this. Muscles that serve to antagonize some of these actions in multi-action muscles tend to be, the word that we use for this situation is fixation. We say that other muscle is serving as a fixator. So whatever muscle that we were contracting in order to negate this flexion would be a fixator muscle, and whatever shoulder extensor muscle that we were contracting to negate this shoulder flexion would be a fixator muscle. So when you hear the term fixator, simply think, hey, that's an antagonistic muscle that's being contracted in order to prevent certain actions of multi-action muscles from occurring. It's all fixators are antagonistic, and so they're just antagonistic to certain of the actions of the muscle that we're talking about. That makes sense to you? It's a kind of a hard concept. It's like riding a bicycle. Once you do it, it's easy. Until then, it seems impossible, and you need the training wheels. But any other questions, Seth?
Yeah. Are we born knowing how to use synergistic and antagonistic muscles to produce movement, or do we have to?
We actually have to
develop that in
kind of
early
learn.
childhood?
We can do some. Our locomotor skills are very limited at birth, and you know, newborns, they can't roll, they can't even turn over, they can't crawl yet. They can suckle, they can breathe, they can do certain kinds of things. We have a lot of that has to be learned over a period of time. So there's a lot of neuromuscular physiological connections that are made with the brain. Even as adults, you know, we can do the usual kinds of things like walk and chew gum at the same time maybe. But if we walk onto a tennis court, we don't have an ace-type serve right away. Matter of fact, it takes a long time to develop a tennis serve. I discovered that and finally gave up and played a game called racquetball. I like that better. You stand in one place, wait long enough, the ball comes by. You know. But their particular motor skills, you know, and in certain kinds of things do require a learning process that we may not even tackle until late adulthood sometime. But there's a lot that has to be learned. You watch a 2-year-old negotiate a stairway sometime. You know, every movement is carefully planned on that stairway, you know. Whereas we come to a stairway, we just think, oh, there's a stairway, you know, and we just do it. But when you're real young, you're still learning all those kinds of things and fine-tuning all those. There's part of the brain, we haven't talked about the nervous system yet, but there's a part of the brain called the cerebellum, and that cerebellum actually coordinates skeletal muscle activity and kind of serves as a computer so that when you say, hey, I want to put that spoon of cereal, you know, in my oral cavity here, you know, as an adult, that's not a big issue. But there again, as a 2-year-old, you tend to end up with it several different places before you get it where you want it. Any other questions? All right, let's take a look at a graphic that summarizes what we just said about the functional relationships of muscles. Muscles that have same action, we use the word synergist. A muscle that has opposite action from one we're talking about is an antagonist. And a muscle that is currently serving as an antagonist to certain actions of a multi-action muscle is called a fixator. Now, I want to talk a little bit about muscle names because there's a lot of terms that are used in the names of muscles, and all those terms have descriptive and instructional value. Let's go to the overhead camera for just a second, and let's take a look at a name of a muscle like the extensor carpi radialis longus muscle. Now, it takes 1, 2, 3, 4, 5 words to name this particular muscle. And this is a muscle that's found here in the anterior antebrachium. This posterior antebrachial muscle, actually. This muscle, every one of these words have particular meanings in the name. The extensor and carpi together, these two words tell us what that muscle does. from a functional standpoint, it extends the carpal joint. The radialis part of the name here says that that muscle lies next to a bone called the what? Radius. The longus separates it from another muscle whose name is exactly like this, except that muscle is called the extensor carpi radialis brevis muscle. So the longus, physically a little bit longer, brevis, physically a little bit shorter, a little briefer, you see. And then this tells us that it's a muscle, that it's not a nerve, it's not a bone, it's not a blood vessel, it's in fact a muscle. Now, you can't walk up to a strange muscle and look at its name and necessarily know what every one of these words mean for that muscle. But as you study individual muscles, then every one of the words means something in particular for that muscle. Now, some muscles have just, single word names like supraspinatus muscle, supraspinatus muscle. But that word supraspinatus does have some instructional value once you realize that that is physically originating in a bony depression on the scapula that's called the supraspinous fossa of the scapula. Does that make sense? So when you see a name of a muscle as you're studying, when you get to the point where you're studying individual names of individual muscles, and you see a particular name, you need to ask yourself, what particular thing about this muscle was that word chosen to represent? Chosen to give me some instructional or descriptive knowledge about that particular muscle. I mean, we could have just numbered them from 1 to 230, and muscle 179. Okay, everybody got that in mind? See, you see, but if we say quadriceps femoris, how many parts do you suppose a quadriceps femoris is going to have?
4.
4. Ceps means heads. It's got 4 heads, 4 components, 4 named entities. Femoris, you think it's a muscle that's found in the superior limb?
No.
No, I don't think so. I bet it's found down in the thigh, probably right next to the femur bone, don't you imagine? Right. So that's the kind of thing I'm talking about. Triceps brachii. Triceps brachii. How many parts?
3.
Uh-huh. And what bone would a triceps brachii lay next to?
The humerus.
It'd lie next to the humerus because it'd be found within a part of the superior limb called the brachium, and the only bone within the brachium is the humerus. That makes sense?
Right.
Yes.
So sometimes the name has a lot of information in it, and sometimes the name just doesn't have a whole lot. Pronator teres muscle tells you what it does, doesn't tell you too much about where it's located, or doesn't tell you origin or insertion or anything like that. Deltoideus muscle. That name, incidentally, it's this particular muscle right here, kind of caps the shoulder regions, this guy right here. I don't know if the camera can sweep over here and see this on this, my little vertically challenged muscular assistant here. But the deltoideus muscle was named deltoideus because it inserts on the deltoid tuberosity of the humerus. Now, until you know that much detail about the skeleton, that's not very helpful. But once you know that there is a deltoid tuberosity of the humerus and that's where this muscle attaches, then you think, hey, that's why they called it the deltoideus muscle, because of that particular attachment to that particular bony prominence. And there's a lot of muscles that are like, let's take a look at some graphics that summarize some of those terms used in muscle names. Some of the terms that are used actually have to do with the configuration of those muscles. Like the trapezius has a trapezoidal overall shape. It's 4-sided, okay, like 2 triangles stuck together. The piriformis muscle is pear-shaped. A muscle with the name serratus in it probably has a sawtoothed edge. As far as just examples of some terms that are used to denote size, a muscle that has the word maximus in it is a big one. If it has minor in it, it's a little one. If it has brevis in it, it's a little one. Can anybody think of any other terms that might mean a big one besides maximus. How about Susan?
Magnus.
Magnus. There's some certain muscles have the word magnus in their names. How about
Major.
major? The word major. There's the major pectoral muscle versus the minor pectoral muscle. How about vastus, like the vastus lateralis? You know, right now we've got an American cyclist who's quite famous because he's already won 5 Tour de France races. Anybody remember what his name is? Lance Armstrong. When Lance Armstrong comes into a room, the various parts of his quadriceps femoris come in about a step before he gets there. You know, he's basically thighs and lungs, okay? And he's a cycling machine, isn't he? Anyway, the vastus lateralis and the vastus medialis are subparts of that quadriceps femoris, very large muscle bellies. Go back to that graphic now. We'll go to fiber orientation here. If the muscle name has the word obliquus in it, it implies that the fibers are running at some kind of an angle. If it has the word rectus, the fibers are running straight and probably parallel with each other. Sometimes we just use the word angularis to indicate some kind of an configuration of the muscle fibers. Action, we talked about action in a previous session where we talked about joint motions, but quite often the muscle names will have words like flexor or extensor or depressor or tensor, so forth and so on, to indicate what that particular muscle does. Positional indicators in muscle names include things like superficial and what would be the opposite of that, incidentally? Deep. Anterior or maybe posterior, medial or lateral, and so forth. Number of parts. You know, biceps implies 2 heads, tertius implies 3 things, multifidi, a whole bunch. See? And quadriceps says basically 4 heads. So those are some of the kinds. Let's look at a second graphic that continues this same thing now, other terms that are used in muscle names. Some of the terms indicate location. Like if a muscle's got the word lumborum in its name, it's probably found in the lumbar region. If it's got ulnaris in its name, it's probably closely associated with the ulna. Cervicis would imply somewhere in the anterior aspect of the neck. Names that have something to do with attachments, we've already talked about the deltoideus attaching to the deltoid tuberosity of the humerus. A muscle that's called zygomaticus. There's a major and a minor version of this. This attaches to a bony landmark called the zygomatic arch. Muscle with mentalis in its name attaches in the chin region, the mental region, which is the chin. And then parts of the body actodon are sometimes included in muscle names. Like if a muscle has a name that says something like digiti, then it probably is going to attach into a digit, one of the phalanges. If it says oculi, it's probably going to have something to do with an eye, and so forth and so on. Do those things make sense to you? As you study various muscles and see the names of the various muscles of the body, I want you to think of some of these names and just ask yourself, what is there about that name that they are trying to get across with the words that were chosen? Sometimes when you look at the names, you say to yourself, why did the international group of anatomists pick that particular name for that muscle? I mean, I've asked that question many times myself. But really, when you study it for a long period of time, you realize there's considerable wisdom and thought process went into the selection of the various names. Do you have any questions about names used in muscles or anything else that we've talked about today, or maybe something we haven't mentioned? Eva?
Why is it that when people work out, their muscles get bigger, or maybe when they are not working out, have bed rest or something, their muscles get much, much smaller? What causes that?
If you don't use a particular muscle, if you don't contract it for many days on end, that muscle will actually undergo what's called atrophy. It'll get physically smaller and smaller and smaller. Those of us who have had fractures and had parts of limbs in casts, for example. I remember I had a pretty bad fracture of an ankle joint region one time and had to have a cast on for a few months, in fact. And when they cut the cast off and I saw what was inside there, I said, wait a minute, it's wrong leg. You know, that's not my leg. Because, you know, my little chicken leg had become even skinnier within that cast because I hadn't been using those muscles. That's atrophy. So the muscle tissue will shrink away and it'll actually get replaced slowly but surely over time with connective tissue proper if you never contract it. By the same token, if we go down to the gym and start cranking on the weights and perhaps using these muscles to a much greater degree than what we would use them in everyday life, so we're lifting heavier weights and we're actually exercising the muscles to a greater degree, then those same muscles will undergo hypertrophy. They will actually get larger. Now, I'm not saying that every one of us could go down to the gym and get on a exercise program and necessarily turn into a prize-winning bodybuilder type physique. By the same token, all of us can get stronger and bigger if we want to by proper exercise.
Okay, and another question concerning this. So if they're getting bigger, you said a couple sessions before that muscle cells have a very low regenerative capacity, so they don't divide very much. So how do they get actually larger
How do they get
physically?
bigger? That's an interesting question. The number of cells does not change. However many skeletal muscle cells are in your biceps brachii is what you have for life. But the size of the individual cells does change. And the way it changes is those individual muscle cells under a heavy exercise regimen will actually increase the number of contractile proteins that are present within their cytoplasm. So they have actual more contractile organelles that are in there. So the individual cells get larger, all the cells get larger, the whole muscle belly gets larger. So that's we call, you know, when we talk about going down to the gym and working out, we're not increasing the number of muscle cells, we're making the muscle cells larger that we have individually. That makes sense to everybody? And when a muscle is injured, you know, we lose those cells. If we cut across them and they die, then those cells are not going to be present. I think we're out.